Welcome to Graceful Aging. I'm your host, Gregory Vader. I'm delighted to have from the Harvard School of Dental Medicine, Dr. Leonard Brennan. Thank you so much for being with us. Good. Dentistry, going to a dentist's office, it's not a terrible experience though, is it? It doesn't have to be.
No, it doesn't have to be a terrible experience. It should be a learning experience. And what's interesting over the course of my career, over the course of 30 years, prevention is working. So when children came into the dental office 30 years ago, the decay rate was very, very high. And what has been wonderful to see over the course of a career is to see the decay rate for young children drop to a remarkably low level. Unfortunately, the decay rate for our senior population hasn't had that same luxury. One of my goals over the last 30 years was to take some of the prevention methods that work so well for children and implement them in adults, and they work as well, if not better. With the population increasing and the dental population really staying the same, there will be a shortage of dentists for the population. So it's important for the dental community and for patients to be thinking, how do I maintain a healthy lifestyle preventatively, cheaper, and I can maintain my teeth longer? And the educational part is more than just educating patients, but family members and physicians, so that the community works as a team to help maintain healthy teeth for a community, for the senior population. Well, we tend to think of teeth locally, but we need to think more universally. Our teeth affects distant areas from your teeth. Now, when you look at the teeth and you'll see the cause of the bacteria that causes the disease, it's influenced by a lot of different factors. But the fact is that the bacteria that can cause these diseases, it's being shown in studies, will not only affect teeth and gum, but can affect distant organs, vasculature, possibly heart tissues. It can influence diabetes and arthritis. And many of the diseases that are common in the elderly, there can be a direct effect. So when we think, part of our mission is to have people think more universally and not locally. The oral cavity is as much a part of us as the rest of us, and which is why I think you're hearing a lot today about we want the medical community to be part of what we do, and they need to be educated on a comfort level that they can go in and take a look at the oral cavity and feel some comfort in at least what pathology is, so they can be used as a referral basis. Dentistry today has come a really long way in being physicians of the mouth. We have been trained to diagnose, take good histories, and to be a referral basis for physicians. And so it's very important for the physicians also to partner back so that they can detect lesions or pathology so that they can be referred back to the dentist. I always will chat with the physicians. I think it's important for the physician to know that I care about them medically, because ultimately part of my goal is I want them to be concerned about them dentally. If you want your patient to eat, they need to have a healthy oral environment. It's connected. If someone said, where do you start with your dentist? It's communication and listening, right from the very beginning. So ideally, you would like to have a patient come in and ask questions. I'll have my patients write down on an index card before they come in their questions. If they think the number of questions is too many for the time allotted, they send me their card. And I'll say, these are great questions. You don't need 15 minutes, you need a half hour. But the communication is what's important. So the health history can be sent to a patient, they can fill it out, I can get it back. That I can make calls to the physician, to family, to healthcare providers before they make that visit. One of the things you want to look at as a patient is that we're treating you. You're not treating us. And that's very important to realize, because if you think they're treating me, you give yourself the freedom and you give yourself permission to ask those questions.
really communicated that well for our folks, and I hope that the individuals and their families and the other dentists and doctors out in the world broaden their approach that you've just described. It's been beautiful, and I know it's been very helpful to the people out there. So Dr. Leonard Brennan, thank you so much for being with us.
Thank you. It's a pleasure. Always is to talk about geriatrics.